Hello, everyone, and welcome. Today we're going to be demystifying a really fascinating homeopathic remedy called Abrotanum. So let's just dive right in. Now, to make sure we're getting the best, most accurate information possible, everything we're going to talk about today is coming straight out of a professional homeopathic materia medica. This way we get a really authentic, by-the-book understanding of this remedy. All right, so here's our game plan for today. We'll kick things off with a basic introduction to Abrotanum. Then we'll build a really clear picture of the patient who needs it. After that, we'll zero in on its main job, tackling wasting or marasmus. We'll also look at other important symptoms, and finally, we'll see how it compares to other similar remedies. So, first things first, what in the world is Abrotanum? And what does it even come from? Let's get into its origins. Okay, so Abrotanum is a medicine made from a plant called southern wood. मतलब एक पौधे से बनाई गई दवा है. The main preparation, the mother tincture, is made using its leaves and stems. In homeopathy, you'll see it used mostly for two big things: marasmus, which is a condition of severe wasting, especially in kids, and rheumatism. Now that we know what it is, let's get into the really interesting part. Who is the typical Abrotanum person? In homeopathy, we call this the patient's constitution or the remedy picture. It's like a personality profile for the medicine. This is all about the patient's physical makeup. शरीर की बनावट कैसी होती है. What does the person who needs this remedy actually look like? This slide paints a very clear picture. The Abrotanum patient is often very thin or emaciated, and this is especially noticeable in their legs. What's striking is that even a child's face can look old, pale, and wrinkled. The skin is often flabby and just hangs in loose folds. There's also a profound weakness, so much so that a child can't even hold their own head up. These patients are also what we call chilly. They feel cold very easily. And often, there's an underlying constitutional weakness that we call a tubercular diathesis. All right, this is where Abrotanum really shines. Its main area of action, its whole reason for being, is to address marasmus, that condition of extreme wasting we mentioned. This is its core issue. So what is marasmus exactly? It basically means the body is just wasting away day by day. जिस्म का सूखते जाना, खासकर बच्चों में. It happens because the body just can't absorb nutrients properly from food. The digestion is off and the body isn't getting any benefit from what's being eaten. And this right here is the central paradox, the key thing you have to remember about Abrotanum. Look at this. The patient has a huge appetite. Bhook bahut lagti hai. They eat really well. But despite all that food, they just keep losing weight and wasting away. The body simply can't seem to use the nutrition it's being given. So we know wasting is the big one. But what other clues guide a homeopath to think of Abrotanum? Let's build out the rest of the picture, beyond just the wasting. Mentally and emotionally, you often see real extremes. On one hand, the patient can be incredibly irritable, cross, even cruel and violent. But on the other hand, they can be deeply sad, despondent, and just plain ill-natured. It's a very distinct and often difficult temperament. Physically, besides the wasting, you'll often see rheumatism and gout. The joints get really painful, stiff, and inflamed, but here's a key detail. There's usually no swelling. They also have stomach problems, like passing undigested food in their stool, which often alternates with being constipated. And this last point is super important. These problems often pop up right after some natural discharge, like diarrhea was suddenly stopped or suppressed. Okay, now we're getting into the fine print. In homeopathy, these details are everything. We call them modalities, the specific things that make a patient feel better or worse. This is how we really start to tell Abrotanum apart from other remedies. It's actually pretty clear-cut for Abrotanum. What makes things worse? The cold and the nighttime. The symptoms just flare up then. And what makes them feel better? Motion. Just getting up and moving around provides relief. This is a huge clue. And that leads us to a really crucial question. Homeopathy has quite a few remedies for wasting and marasmus. So how do you know when to use Abrotanum for something else? How do you tell them apart? This table just lays it out so perfectly. Look at the differences. With Abrotanum, the wasting is most obvious in the lower limbs, the legs. But for Natramur, it's the neck that gets skinny. An iodine patient is wasting away, but they feel very hot all the time. A Cilicia child often has a disproportionately large head. And a sulfur patient, they might have a pot belly and absolutely hate being washed. See how specific it gets? It's absolutely fascinating. And here's one more close comparison. A remedy called tuberculinum. The key phrase for this one is so memorable. The baby loses flesh while living well. It sounds similar to Abrotanum, but that slight difference in phrasing points to a whole different remedy. Getting these details right is so important. So when you really think about it, we have a remedy from a simple plant, a weed really, that addresses such a specific, detailed, and profound set of human conditions. It really makes you wonder, doesn't it? What does that tell us about the incredible, intricate connection between nature and medicine? It's definitely some food for thought. Thanks for joining us today.